Get ready for the national debate over public opinion on health care. The president fired the first shot yesterday in Iowa. Listen here.
This is the reform that some folks in Washington are still hollering about, still shouting about. Now that they passed it, now that we passed it, they're already promising to repeal it. They're actually going to run on a platform of repeal in November. You've been hearing that. And my attitude is, go for it. If they want to have that fight, we can have it. Because I don't believe that the American people are going to put the insurance industry back in the driver's seat. We've already been there. We're not going back. This country's moving forward.
Republicans, for that matter, say there are pieces of the law that benefit the American people, but other aspects need to go. This from ABC earlier today, and Massachusetts Senator Scott Brown.
I believe the president's rhetoric on that is inappropriate because he's talking certainly about all the bad things. We're all in favor of the catastrophic care coverages, the pre-existing coverages for children. Those are all the good things. But what about all the backroom deals? What about the medical device taxes in Massachusetts that are going to affect companies in Massachusetts, about 22,000 jobs? And why do we need 16,500 IRS agents? That tells you a lot right there. We're not talking about the fact that this bill was rammed through parliamentary maneuvers and procedures in an unprecedented way in order to get this done against the will of the people.
So the two sides have now been joined. Rick Tyler's founding director of Renewing American Leadership, also a spokesman for the former House Speaker Newt Gingrich. Kirsten Powers is a columnist for the New York Post and a Fox News political analyst. Good morning to both of you. Rick,
good morning.
The president thinks repeal is a losing issue in 2010. Is it or not?
Well, I think the aspects that need to be repealed are, for instance, the $600 billion in new taxes, the 3% costs on medical devices that Scott Brown just mentioned, the $500 million cut in Medicaid. All these taxes, by the way, someone's going to have to pay for, which will make prices more expensive, not less expensive. So we can look at the parts of the repeal, parts of the bill that we need to be repealed, because what we've traded, the president said he doesn't want insurance companies in charge of health care, but what he substituted was the government and not the patients.
Well, the plan doesn't fully kick in for at least 4 more years. Some aspects of it don't kick in for another 8 years, but the taxes and the fees do. Kirsten, what about that? Has Rick got a point?
Well, the repeal there's no way to repeal it piecemeal, and the repeal that the Republicans are looking for, at least in the cases that are being brought, is a full-scale repeal of it, and basically to find the plan unconstitutional. So to say, well, we support these aspects of it, but we're still going to have everything repealed, I don't think is really going to resonate that well. I think to say to people, we're now going to go back to, when there's no ban on pre-existing conditions, we're going to, oh, you think you can have your kids on your health care plan until age 26? Well, we're going to take that away. I mean, I think politically that's the way it's going to play. There's just no way to pick it apart and say we want to take these parts
on
out.
all this is they believe that Americans will see this as they did the stimulus bill. $787 billion, and the argument is out there that it's ineffective and has not worked, and unemployment still shot way above 8%, which is against the projection from the White House. Rick, do you believe they'll see it that way?
Well, look, I want to respond to one thing Kirsten said, which is explicitly wrong. The Constitution says one Congress cannot encumber another Congress, so of course you can repeal. You can repeal any part of the bill you want. That's what Congress is there for.
But that's not. But I'm not talking about Congress. I'm talking about the cases that are being brought to find it unconstitutional.
Well, they can certainly do that, and they can try that, but there's no reason that Congress couldn't repeal all the bad things that are in the bill. Look, I'm sure that Mitt Romney, when he gave his speech after Massachusetts passed its universal coverage bill, believed all the things that Barack Obama now believes and said yesterday. By the way, I think his challenge was rather childish. But the truth is in Massachusetts that state spending has gone up 52%. Emergency room visits that were supposed to go down 75% actually increased 20%. The hospitals that treat the poor are actually suing the state because they're going out of business, including one, the Boston Medical Center, only gets 64 cents on every single dollar, and it's losing $181 billion a year. The Mayo Clinic in Arizona has the same problem. They lose almost $750 million per year, and they've cut off Medicare patients. That's what's going to happen. The CBO, of course, scores impact on government implications of a bill, but it doesn't score the over impact in the economy. And if you put doctors and insurance companies out of business, how in the world are we going to have the health care, which will result in less access to care, lower quality, and higher costs? There's no question about this.
You referred to the Mayo Clinic in Arizona or the one in Minnesota? Sorry, Rick, clarify.
That's the one in Arizona.
In Arizona.
The Mayo Clinic
Here's
loses
someone about
$750 million a year.
What about that argument?
What about what? I mean, I don't. There's just this large-scale attack from all over the place. I feel
it's
like
called math.
No, it's not. It's not called math. I mean, you guys
it is called math.
You use the CBO numbers when they benefit you. You ignore them when they say that they cut the deficit. The reality is you can. No, I actually don't. I mean, I actually have made an argument that there's a moral imperative
all I said
to
is
have
the CBO numbers.
I'm in the middle of a sentence. I'm in the middle of a
ahead.
sentence. I sat and listened to you. I made an argument that there's a moral imperative for this. And if it makes the deficit go up, I'm okay with it. So I actually haven't made that argument. I'm just saying that the CBO says that it will cut the deficit over time. So you can pick and choose these different things and claim the economy is going to collapse. But when the CBO was scoring against Obama, Republicans were quoting the CBO.
Just get back to the original point,
that.
guys. I've got to run here, but most polls still indicate that the majority of Americans are against this bill. And now we're going to find out over the next 8 months and in the coming years whether or not those numbers change. And that's where the two sides will join this debate. Kirsten, thank you. Rick, thanks to you also. Okay, have a good weekend.
Take care.